Hi guys, how is everyone? Welcome back to my channel and welcome back to our second edition of our health classroom. It's been a while, probably more than a month since we did the very first edition of our health classroom. And the topic that we had before was diabetes. And we're going to discuss another common medical condition, a common medical condition that is easily treatable and preventable. We're going to be discussing UTI. What is UTI? Probably you get it too from time to time. If you want to find out, stay tuned. I just arrived from work. I have decided to do this video because I want to share to you my knowledge about UTI. It is very common out in the community, and I want you to have that basic knowledge on how to look after yourself, on how to self-diagnose and look for those symptoms, common symptoms of UTI, so that you can report your symptoms to your medical doctor, and then you'll be provided a treatment. So what is UTI? UTI stands for urinary tract infection, also called bladder infection sometimes. It is an infection in any part of the urinary system. So this is your urinary system, particularly the kidneys, the bladder, or urethra. If it involves your kidneys, the medical term is pyelonephritis. If it involves your urethra, the medical condition is called urethritis. If it's involving your bladder, it is called cystitis. It is self-diagnosable, meaning you can diagnose UTI yourself. How? Well, if you have these signs and symptoms, then it's easily diagnosable. What are these signs and symptoms? The common ones are pelvic pain. Okay, the pelvic area is the area on your back below the waistline. Okay, there is also an increased urge to urinate. Okay, so that means you go to the toilet quite often, passing water. There's also pain in urination. So when you pass water, you experience that pain. And sometimes there's also blood in urine. Okay, now if it involves your kidneys, if you have kidney infection, then the common symptoms are back pain, nausea and vomiting, and fever. Okay, other symptoms: foul smelling urine, pain in the groin. Sometimes it can lead to confusion as well. Okay, pain in the lower abdomen. Sometimes the color of your urine could be cloudy or dark. Okay, and you will experience extreme tiredness or fatigue. And for women, sometimes you will have vaginal irritation. Okay, and sometimes if you engage yourself in sexual intercourse, there's also painful sex. Okay, what are the treatments? It can be antibiotics. Okay, you just have to make sure that you're not allergic to some types of antibiotics, so that your doctor will know what type of antibiotics they will prescribe to you. Okay, increase your fluid intake. Okay, that means water. Okay, no caffeine, no alcoholic beverages, no colas, but just pure water. Good genital hygiene. Okay, you need to wash more often or regularly, especially if you just use the toilet. Okay, avoid too much alcohol or caffeine. That's what I said earlier. Urinate frequently. That means you need to empty your bladder on a regular basis, because urine is waste, and if the waste is not being removed out of your body, then it can cause infection because of the bacteria. And a lot of people ask me, Why is it common amongst women? Well, it has something to do on the anatomy of the urethra amongst women. See, the urethra of women is shorter compared to men. So it is easy for the bacteria to travel from the outside to the urethra, easily for the bacteria to travel. So if you experience the symptoms, then don't hesitate to approach your medical practitioner and tell them the symptoms that you are experiencing. And if it's indeed UTI, don't worry, it's easily treatable as long as you will see your medical practitioner as soon as you've experienced any of these symptoms. How to prevent UTI from happening? Well, like what I said before, you need to have a good genital hygiene, okay? Especially amongst women. If you wash your private part, okay, if you use number 2, if you did number 2, that means you've opened your bowels, okay? So when you wipe your private bit, please don't wipe from back to front, okay? Upwards. You need to wipe from front to back, upwards. Because if you wipe your private area from back to front upwards, you're actually dragging the bacteria, or you're spreading the bacteria from your anus to your vagina, okay? Remember, women are very prone to having UTI, to experience UTI because of your shorter urethra. So once the bacteria reaches your vagina, it will be easier for the bacteria to penetrate the vaginal opening, then travels to your urethra, and who knows, it might affect your kidneys, it might affect your different parts of your body. So make sure that you have a good hygiene down there, cleaning from front to back upwards, rather than cleaning from back to front upwards. Drink plenty of water, okay? Use the toilet regularly. Don't hold your bladder because you need to remove that waste material out of your body, and that is your urine. Your urine is a waste, so it needs to be removed on a regular basis. Now, for people who are sexually active, okay, if you will use a lubricant, please use a water-based or water-soluble lubricant, okay? It will also help kill the bacteria if you urinate after sex, because urine is acidic and it will kill the bacteria. So I'm gonna end my video here. I've just decided to do this short video about UTI because at work today, I just came back from work. At work today, I've seen a lot of UTI in the clinic. So hopefully you've learned something today. Until our next health classroom. Look after your body. Be healthy. Stay healthy. Bye.